Today we will discuss Meditech changes on the inpatient RN group assessments pre and post Tenecteplase. These are new group assessments to help with your documentation. There is a new assessment for Tenecteplase documentation called pre and post Tenecteplase. This is being added to Meditech during the week of January 31st and should be completely there by February 3rd. Once the TNK has been ordered, the RN will need to add the group assessment to their interventions. To do this, you will click on Intervention Multi-Select, type Pre in the search box, and you will see the interventions listed below. Choose the Pre-Post Tenecteplase and click Add and Close to your intervention screen. You will now see the group assessments show up on your screen. NIH stroke scale, neuroassessment, vital signs, thrombolytic adverse reaction, and physician notification. The thrombolytic adverse reaction is a new intervention which was just built. This should be done at the same frequency as your neurological and vital sign assessments. It will include abnormal bleeding, oral lingual swelling, and new onset of severe headache. Any of these you will need to contact your physician immediately. Therefore, physician notification is listed in the set so that you can just click in there and document, as well as if you have a change in your NIH by more than 3 points, if you have a change in your LOC. You would also be calling the physician and therefore can use that physician notification to document. You do not have to document in that physician notification with every group assessment. Once you have added the intervention to your list, the frequency of the times based on where you are in the series can be added. To do so, you will click under the frequency status next to the right of New. At this point, you need to figure out where you're at in your vitals and neuro assessments based on your stroke tracker. Make sure that you have the date and time the next intervention is due. This is especially important if you're going from 11 o'clock on the 5th to midnight on the 6th. Make sure that the date is correct and the time is correct. Then you will enter the frequency. If this is the first data point after TNK was given, you would put in period Q 15 minutes times 8, comma, Q 30 times 12, comma, and Q1 times 16, just as it is seen there. You must have that leading period or the frequency will not add correctly. If you look in the bottom picture, you can see exactly how it should be typed in. Here is another example. The patient came from the ER, and the ER already did 4 of the 8 required 15-minute vitals. The TNK was pushed at 9:50, and they started the first vital at 10. They already did 4, so the next time due is 11. Therefore, you would enter the time as 11 o'clock, the date would be 1/17/23, and then you would enter the frequency as period Q 15 minutes times 4, comma, Q 30 times 12, comma, Q1 times 16. Again, remember, you must place that leading period. Once you have gotten that far, you will click on one of the interventions. In this case, I chose vital sign. You click on vital signs. If you need to edit the date and time, you can do so now. However, you shouldn't have to, as these have all been, the frequency is all set up for you. Once you're done entering the vital signs, you will click Go To, and then when you've finished all of them, you will click Save. If needed at any point, you can add an occurrence. When you have completed that first set of data and you're on your second time that you will be documenting, You go to your pre and post Tenecteplase, you choose document, and then you choose your intervention choice. Before you start to enter any data, choose recall values at the bottom. When you do so, this will bring up certain variables that will remain the same. Once you start documenting in the page, you cannot add recall values, so be sure to do it first before you document. In this example, pulse occurrence number 1 is on the left and the location is monitor. This will recall that, but you will still need to enter all of the values. You can use recall on all of the assessments in these group assessments. Just be sure to make the appropriate changes. If your pulse is on the right side now, you will need to insert an occurrence and then document appropriately, leaving the left pulse occurrence blank. Because the pulse is on the left side, it will not be documented and you will need to discontinue that occurrence. Once you click into the pulse rate box on the occurrence number 1 for the left pulse, then you can go down to the bottom and click discontinue occurrence. This will then remove occurrence number 1 and leave the occurrence number 2, which now becomes occurrence number 1. Finish documenting all of your vitals and then click on Go to go to the next assessment and choose the assessment that you want it to document on next. Click Recall on the bottom and then start documenting. The process we just used for inserting and removing occurrences can be followed anywhere an occurrence needs to be inserted or removed. Make sure all of the appropriate changes to the assessments have been made. This will be especially important in your NIH scale and neuro exam. Neuro assessment changes. There have been some changes made to the neuro assessments. The strength section has been updated to give a more meaningful information. Strength occurrence has also been updated to add multiple occurrences to be extremity location precise. The neuro assessment has also been updated so that the same neuro exam will be done from the ED through inpatient after TNK. In the ICU, once TNK intervention is complete, you will then switch over and use the acute neurological critical care assessment for your hourly neurochecks. This assessment will soon be edited to have the same strength assessment available as the one that you are seeing now on the screen. If you have any questions or concerns or ideas on improving stroke care or stroke documentation, contact your manager or stroke coordinator at your site. Thank you for all you're doing for our stroke patients. Have a great day.